Dr. J.
How you doing, Scotty?
10 years ago, I moved to Newport Beach. I needed to find a chiropractor, ART guy, to fix at the time my ACL, right?
Yep.
I think my ACL.
I think so.
Had a trainer at Boris Sports Corp that put me in touch with you. You were a young, inspiring guy from Philly,
Right.
train junkie, mountain bike junkie.
Right.
Anyway, I reached out to you. I remember first class you were working out at a little gym and took care of the knee, got me back to where I needed to be at the time. And then, geez, a wedding later, a bunch of kids later, a bunch of different athletes, and a Stanley Cup for your team, the St. Louis Blues.
Right.
A long time coming.
Yeah. I think the 10 years ago, I had just been out of chiropractic school. I'm in my 14th year, so we had met like 4 years new as being a green DC, and like you had mentioned, I had studied ART and Trigenics and a bunch of other things, and I was either right on the cusp of meeting Guy Voyer at the time, or it really hadn't quite happened for me yet. I'm not really sure about it because we're starting to like get really close to my June 2011. So I
always used to come in and you'd have you'd be sitting on a Bosu ball behind your desk.
Oh,
I'm like,
that's
look
right.
at this guy. And then I'd see a bunch of, there'd be girls leaving, there'd be athletes leaving. I'm like, this guy must know what he's talking about. And then you're a good guy, so it made sense that, I had to make that part of my therapy, and part of my training was always to, as you know, like to take care of my body away from just the gym,
right,
away from the rink at the time, which I think is important to all athletes. But yeah, you put me on a good stretching program. I think you focused a lot on my pelvis at the time.
Always.
A lot of knee injuries or ankle injuries are not really in the knee itself. They start other places. So could you maybe describe what you find in most guys that kind of tends to be problems that...
Sure, manifest other places.
Yeah.
I think you mentioned it. The pelvis is the king of the roost as far as I'm concerned. That dictates how well the hip moves, which dictates how well the knee moves, and the ankle and foot, and vice versa. The ankle and foot dictate how the knee moves. So we get this place in the middle, I think, that the knee can be attacked or applied or affected by either end. And I think the biggest thing that I find that's overlooked in cases of all types, people with chronic back pain or people that are high-level athletes, is the pelvis piece. The mobility of the pelvis, the micro movement of the pelvis is really what we addressed back then. Your pelvis was stuck. I remember, enough of it. Your pelvis gets stuck, you start moving and skating differently, and you start exposing other problems, or other potential problems, I should say.
Yeah, you used to have that table with the...
I had a whole Leander Light flexion distraction.
It was unbelievable.
Everybody loves that table. I got rid of that table a long time ago.
Work the bottom of the legs, the back. It would just suppress the spine. It felt unreal.
Everybody loves that feeling for the low back. It's kind of a little self-decompression.
Yeah, no, so I look back at some of the issues that I've had that I've needed you to address, and, often things do stem from, my lower back. You'd always give me trouble when I'd be deadlifting a lot of weights, or I'd come in after maybe not training, going on vacation for a little bit, and I had a week off, and I got back into the gym, and all of a sudden my lower back would be sore. And you noticed at the time I had 2 little fractures on my spine.
Right.
That was a root to a lot of my lower back pain that could throw me off for a while. So
that's when we attempted to kind of slow down some of the heavier lifting stuff, right? That was, 10 years ago. That was quite a long time ago.
And 10 years ago, it was lift as much as you can.
Right.
My coaches and my trainers were always like, you need to be stronger. Guys in our league are big. You want to put on as much muscle in the summer as you can. Now I've talked to numerous guys, and it's more, how do we stay fast? How do we stay on the ice, so not getting hurt? Injury prevention.
Right.
You taught me a lot about that, and I give you credit for that. And a lot of the younger players now that have seen older guys go through, they often ask, like, who does your training? What therapist do you see? What kind of, so I guess what kind of advice could you give to younger guys for the way that they train, whether they're told to do heavy lifting or they're told to?
Yeah, that's Pandora's box, right? That's a difficult one, but I will tell you that based on experience with a lot of guys with your number of years in the league or in other leagues, it really comes down to your ability to change direction. Like, as long as you're fundamentally able to still stay in that elastic kind of explosive state, then I think it doesn't matter as much. But I think there's a really fine line between gaining muscle, as you mentioned, and losing your mobility. And I think there's a lot of people out there that would agree with me, others that wouldn't, you know what I mean?
Yeah, for sure.
But if one starts sacrificing for the other, if you start losing your flexibility and ability to change direction and deceleration, then you're starting to head in the wrong direction. And that usually gets labeled as part of the aged athlete. And I always tell the athletes, no matter how young or old they are, the aging process, the number doesn't matter. You're a classic example of, like, the guy looks like he's 27 still, obviously.
Thank you.
But that all has to do with the quality of the tissue, and the quality of the tissue has to do with hydration and how we train it on a regular basis. You all beat yourselves up the same way. You skate a lot, you do this, you hit each other. Like, that all is pretty standard across the league, I would say. But the big thing that I have found over the years is if you can keep you guys being able to change direction at a high quality, which keeps your speed up, then you can compete with all the young guys, all the 21-year-olds. So if you're on the flip side of that, I would just say to the youngest guys in the league, like, make sure you're not training too much with weights and losing any of that God-given talent that you have in speed and quickness and ability to change direction, because one starts decreasing.
For little beach muscles. It's not worth it.
Right,
Yeah,
exactly.
totally.
And this happens in all sports right now, right? We've seen it in the PGA. Like, I think there's been a lot of,
Bryson DeChambeau.
I don't know, there's just a lot of people training a lot more with weights, and I don't know that it's been doing the spine such a great job. My personal opinion.
So you factor in a lot of key things to how you approach nutrition, sleep, advanced therapies and stuff. How important do you think that is to, like, the average person? Like, you just mentioned water, being hydrated, drinking good water.
Drinking good water, absolutely.
What else could you just explain to people? What's like a good routine for people to?
I mean, if it's a new patient and they have a little bit of understanding, it's always water and sleep and high quality food. Like, if you're not starting with that, then
That's something you can control. You can't control a compact sport or
That's right.
a car accident, but to prevent a lot of things, it's what you put in your body. It's how you
move it.
Yeah.
Like, and the next group is why we move. And I try to explain to my patients that, yes, I want you to move and exercise throughout your life for the benefit of your heart, but really it's about moving and keeping the tissue all in high quality, because then it helps a better outcome from a surgery. You know, one of the reasons you exercise before you go to surgery is to improve the quality of the tissue for them to cut and open and do other things.
Pre-therapy rather than post-therapy.
Exactly. And the
Both
same
are
thing
important.
and the same thing with the regular patient. Like, to be able to move a little bit every day helps keep the doctor away, basically.
Yeah, you better keep moving or they're going to start throwing dirt on you.
Yeah, exactly.